Welcome to the second session of the One Health Sentinels tutorial series. In this module, we will examine a core component of the platform, the Dynamic Scorecard. The One Health Sentinel Dynamic Scorecard is an integrated benchmarking and visual analytics tool. Rather than serving as a static data repository, it dynamically harmonizes and cross-references three major international assessment frameworks, namely the WHO's Joint External Evaluation Standards, the OIE's Performance of Veterinary Services, and the FAO UNEP benchmarks across 12 critical domains spanning human, animal, and environmental health. As a One Health Sentinel tutor, I will emphasize four essential functions that this scorecard performs. Number one, identification of cross-sectoral gaps. Most nations assess human health and animal health through separate processes. The scorecard overlays these datasets to reveal blind spots. For example, it may identify a strong rabies vaccination rate in animals but weak post-exposure prophylaxis in humans, or the absence of environmental surveillance for antimicrobial resistance. Number two, dynamic One Health readiness scoring. In contrast to static PDF reports, the scorecard calculates a live composite score across all 12 domains, including zoonoses, food safety, AMR, biosecurity and safety, and wildlife surveillance. As new audit data or benchmark inputs are entered into the platform, the score updates in real time, enabling continuous progress tracking. Number three, prioritization of joint actions. Through color-coded or numeric outputs, the scorecard assists national One Health committees in answering a critical question: which domain exhibits the widest disparity between human and animal health capacities? The answer directly guides resource allocation for joint investments such as laboratory sharing, data integration, or collaborative outbreak simulation exercises. Number four, harmonization of language for policymakers. The WHO, OIE, and FAO employ different indicators and rating scales. The scorecard translates these into common metrics. For instance, a unified capacity level from 1 to 5, so that ministers of health, agriculture, and environment can review the same dashboard and reach consensus on priorities. Although the exact 12 domains are listed dynamically on the scorecard page, they typically align with standard One Health frameworks as follows: Zoonotic Disease Surveillance, Antimicrobial Resistance Stewardship, Food Safety from Farm to Fork, Laboratory Systems covering human and animal health, Emergency Preparedness and Response, Biosafety and Biosecurity, Wildlife and Environmental Health Interface, Veterinary Public Health, Risk Communication and Community Engagement, Health Workforce covering One Health competencies, Data Sharing and Interoperability, Governance and Financing for One Health. In addition, One Health Sentinel incorporates AI-driven gap analysis and prediction, evaluating scores against WHO Joint External Evaluation Standards, OIE PVS, FAO UNEP, and Pandemic Fund indicators to forecast future vulnerabilities. Practical application for learners and auditors. When you navigate to the scorecard link and observe the message "Calculating Scorecard across 12 domains," the platform is performing the following actions: retrieving the latest Joint External Evaluation Standards, PVS, and FAO UNEP benchmarks entered by you or your country. Aligning each indicator to one of the 12 domains. Computing a disparity index, for example, a human health score of 80% versus an animal health score of 45% in Domain 1. Presenting a radar or bar chart viewable after calculation that distinguishes between domains that are One Health aligned and those that remain fragmented. One Health Sentinel's Dynamic Scorecard is more than an audit instrument. It is a catalyst for coordinated dialogue. It compels the human, animal, and environmental health sectors to move beyond their individual report cards and instead examine a single, shared report card for the ecosystem they jointly manage. For a national One Health coordinator, this scorecard serves as a quarterly metric to assess whether joint investments, such as a shared disease database, are effectively closing the gaps identified across the 12 domains. For a student, it provides a practical tool to understand where their country's weakest links lie in preventing the next pandemic. This concludes today's tutorial. In the next tutorial, we will examine One Health Sentinel surveillance feature. This functionality enables multi-species event tracking and integrates AI-powered threat analysis to enhance early warning capabilities across human, animal, and environmental health sectors. To receive notification when the subsequent tutorial is released, we invite you to subscribe to our channel. Thank you for your attention. We look forward to your continued engagement.